So you're applying the pressure upwards, and then you're going to depress your rib cage, and then I want you to bend all the way down, forwards. Nice, and relax.
Nice, that feels good.
How do I know I'm staying on it and it's not just, I'm not just, you know, because it is literally just...
So once you find it, so once you kind of palpate and you get to that kind of guitar string area, once you load it, the way you know you're on it, just keep your position. So like you just hold that now. And you should just feel that tension in your finger. You're not going to feel the tendon the whole way throughout the movement, but you should just feel that you're keeping that tension in that same spot.
Okay.
Back, and do like 5 or 6 reps on that spot. Because it's quite small, you shouldn't have to do that much.
Yeah.
Then I move straight up to the next one, find the next one and kind of move up. So
right.
3 or 4 ribs and then I'd recheck.
Nice. And then move a bit higher up and on the same.
Yeah, so you do the same thing. I'd start lateral again, I just find that guitar string again, that tendon. Yeah, it takes a bit of practice just getting used to finding it.
There's really not much there, is there?
Yeah, it's subtle, yeah, you just need to get used to feeling it. Once you've felt it on a few different people, you'll get used to it. So yeah, it feels like there.
And again.
Yeah, side.
Nice. Nice. Oh, would you go up higher again?
Yeah, I'd probably do like 3 or 4 ribs and then retest.
Oh, got it there.
Let's do one more.
Nice. Nice. Perfect.
Perfect, yeah. And then it's just work up 2 or 3 ribs, then I'll recheck whatever your KPI is, whether it's a test or whether it's a toe touch or something like that.
Yeah.
And then just work from there.
Okay.
Really good.
Yeah, perfect.
So we've just finished week 4, module 4, which is the lumbar spine. So how are you feeling kind of towards the start of the week, Sarah, for module 4?
Like I said before, I was pretty much a little bit apprehensive about being able to fit it all in and stuff. It was what I thought it was going to be, so it's just basically a bit of a progression from the lower and the upper as well. But yeah, it was pretty straightforward, and it's stuff that we've kind of already touched on before anyway, so how the ribcage obviously affects the injuries of the lower limb and how it can obviously ease those off as well, so it all kind of interlinks.
No, definitely, and I think there is a few videos there, but a lot of them are just showing different techniques for different things, but the techniques are the exact same principles, so it's all about finding that myotendinous junction, loading the tissue and just getting it to move. I think the key points for module 4 for me are, first of all, like you touched on there, Sarah, it's really important to nail module 2, because a lot of module 2 stuff is going to feed into your lumbar spine stuff. So a lot of people that come into you with like a back problem, there's probably going to be something lower limb going on there as well, maybe like a posterior knee or some kind of motor adaptations in response to previous injuries, which is now causing the back to get overloaded. Just like the upper limb as well, so more so the lower limb for the lumbar spine, but the upper limb is important to kind of consider as well. So once you have the lower limb and the upper limb, you're kind of on a really good starting point for the lumbar spine anyway, and then it's just zoning in a little bit on the rib cage and a couple of specific things around there. But if you could restore kind of all the coordinated tests for the lower limb, you can restore full range of motion in the lower limb, and then you can restore full range of motion in the rib cage, you're going to fix most lower back issues and most lumbar spine issues.
Okay, would you not say to kind of, you know, if someone came with positive instability, would you say that, would you work on the ribcage first if you knew that that was the issue?
Yeah, exactly, and this is where it all comes back into the history. So, like, you're never ever applying too much weight to one test. In the ideal scenario, you've got history that points to something, you've then got like your generic objective tests that are pointing to the same thing, you've got your passive assessment that are again pointing to the same thing, you've got your coordinated testing which is again pointing to the same thing. So now you've got 3 or 4 different tests that are pointing to like the same 2 or 3 tissues, so you can be really confident to treat them. So like you said, if you've got somebody with a posterior knee but they've got no history in the knee, they've got no history in the ankle, there's nothing jumping out, but they've got a massively stressful job, maybe they've taken a knock into the rib cage on that side, I'd start with the rib cage. Whereas on the same note though, if someone came into a back pain but they had no history of anything going on with their back and actually they had a lot of history in the leg, I'd probably start with the leg first because that's what makes sense from history. So it's again understanding your person's story, going back to module 1. That's the most important thing. Once you have the story, then your assessments are going to kind of point towards the individual tissues. But you need to have the story to kind of relate that back to, otherwise it's just treating for the sake of treating them. That's the situation I hate to be in, and I've been in that situation a few times where you know that you're not really getting much from the patient, they're not telling you kind of much in terms of the history and stuff, and you're just treating what you're seeing. But it's really hard to judge how you're progressing unless you've got context and unless you've got like a real clear aim of where they're trying to go towards. Otherwise you're kind of just like, okay, let's try this and see if it works, let's try this and see if it works, and you're just treating based on assessment findings rather than the whole picture of this is where they came from, this is where they want to be, and these are the steps that we need to take to get there.
Yeah.
But yeah, no, so I think the real key points for Module 4 are the lower limb, like we just talked about, getting the rib cage moving and paying a little bit closer attention to it, and thinking a little bit higher level as well. So if someone's getting pain in a toe touch, like are they getting it just at the start when they start to reach? So like you often see people, getting pain in the toe touch, jump straight to the lower back or jump straight to the glutes. But like at this point, when I just start to reach, my glutes haven't done anything and my back hasn't done anything. It's just like protraction of the shoulders. So if I'm getting pain when I'm doing this, I probably need to look a little bit higher. If I don't get pain doing this and I get pain towards the bottom of the movement, then I probably need to look lower towards like the hip or the glute or something like that. So it's just thinking higher level. When's the pain coming on? What tissues are involved with that movement? What tissues are loading? What tissues are shortening? What tissues are lengthening? And how can I influence that?
I think I've asked you this question before. So that you've got obviously you can lengthen the muscles in the back, or you go to do some manipulations on the obliques. Which would you know to start on first?
Again, that's just it's gonna depend on your patient, definitely. I think if somebody's in a lot of pain, I want to desensitize the pain first. So if somebody's in a lot of pain going into toe touch, I'm probably just going to help the tissues that need to lengthen first, so like the posterior tissues. If someone's not in that much pain or is like just a little bit irritated, and there's something pointing towards this, I probably want to get the obliques on first. So like Sarah's question there, for anyone watching that doesn't kind of understand that, is obviously if I'm going into a toe touch, I'm going to need my obliques to load to get my rib cage down, and I'm going to need like my erectors, my iliocostalis to lengthen as well. So like where do I start? Do I work on getting, if I've got this that's not loading well and these that aren't lengthening well, where do I start? Do I want to get this loading well first, or do I want to get this lengthening well first? And it doesn't really matter. Probably by getting this lengthening better, you'll help this load anyway, and vice versa. By getting this loading, you'll help these lengthen better anyway. But depending on the patient, if someone's really acute, I'd probably help them lengthen first. I get them inside lying, because they probably won't be able to tolerate a lot of the rehab for this yet anyway. So I'll probably just focus on the stretching and stuff first.
It'll be a lot of psychological stuff as well.
Yeah.
They'll want you to go straight to the back, won't they?
Yeah, exactly. If someone's going into a range of back pain, really struggling, and you start treating them in the front, they're going to be like, what's this person doing at all? So you're going to have to meet them halfway as well. So I'd start with if they're really acute, I'd start there. But then likewise, if they're not really acute and actually they're not too bad, they've got a full toe touch, then I'd probably start towards these. So depending on the restriction, I think priority-wise, range of motion is right up there. So like the first thing I want to do is restore full range of motion. So whatever I need to do in terms of help the tissues lengthen for that, I'd probably start there first, and then I'd look more towards the coordinated tests and the output.
Yeah, perfect.
Cool. So that's Module 4. Next week's going to be Module 5. Again, it's very, very similar. There's a lot of stuff there, a lot of new stuff, but it's all following the exact same system. The upper limb is going to be really, really important for Module 5. So again, just like we've got our lower limb and our rib cage for Module 4, we've got our upper limb and our upper rib cage and neck for Module 5. So we'll get into that a little bit more next week. But yeah, it's just following on the exact same system, and then just continuing it from there and applying it to specific tissues.
Perfect.